Welcome to our channel. In today's video, we are going to talk about a syrup that is commonly prescribed for digestive system problems, and that is Mosegor syrup. This syrup contains the active ingredient mosapride citrate, which belongs to a group of medicines known as prokinetic agents. Let us first understand how Mosegor syrup works. Sometimes the stomach and intestines do not move food properly, which causes problems like delayed emptying, bloating, heartburn, and nausea. Mosapride in Mosegor syrup works by stimulating certain receptors in the gut that increase the release of acetylcholine, a chemical that enhances movement of the stomach and intestines. This improves digestion, helps empty the stomach faster, and reduces symptoms of acidity and reflux. Now let's discuss the uses of Mosegor syrup. Doctors usually prescribe it for conditions such as gastroesophageal reflux disease, GERD, where stomach acid flows back into the food pipe causing heartburn, functional dyspepsia, which means indigestion without a clear cause, gastroparesis, or delayed stomach emptying, often seen in diabetic patients, nausea and bloating associated with poor digestion. It may also be used in combination with other medicines like proton pump inhibitors, PPIs, to provide better relief from acidity. Now moving to the dosage. The dosage of Mosegor syrup depends on the age and condition of the patient. For adults, it is usually prescribed 5 to 10 ml 2 to 3 times daily before meals. For children, the dose is adjusted according to body weight and must always be given as per the doctor's advice. It should be taken before meals for maximum benefit. Now let's look at the benefits of Mosegor syrup. It improves stomach and intestinal movement, relieves heartburn, nausea and bloating, helps in faster digestion, and prevents food from staying in the stomach too long, provides better control of acidity when used with other medicines, improves appetite in patients with chronic digestive problems. Like all medicines, Mosegor syrup may also cause some side effects. Common ones include diarrhea, abdominal pain, dry mouth, headache, dizziness. These are usually mild and temporary, but in rare cases, more serious side effects may occur, such as severe allergic reaction with rash, itching, or swelling, palpitations or irregular heartbeat, severe abdominal pain. If any severe reaction occurs, medical help should be sought immediately. Now, let's talk about some precautions. Mosegor syrup should only be taken on a doctor's prescription. It should be used cautiously in patients with liver disease, kidney disease, or heart rhythm problems. It is not recommended for patients with intestinal bleeding, obstruction, or perforation. Pregnant and breastfeeding women should only use it if clearly prescribed by the doctor. Alcohol and smoking should be avoided as they worsen acid reflux symptoms. To summarize, Mosegor syrup is an effective medicine for digestive system problems such as acidity, indigestion, reflux, and delayed stomach emptying. By improving stomach movement and reducing acid related symptoms, it provides relief and improves quality of life. However, it should always be taken under medical supervision and in the correct dose. If you found this video helpful, don't forget to like, share, and subscribe to our channel for more detailed videos on medicines and healthcare.